Hi, I'm Olivia from Public Health, here today to share information about a disease called valley fever. Valley fever is an infection caused by a fungus that grows in the soil in areas of SLO County, the Central Valley, and other areas of the southwestern United States. You can become infected if you breathe in dust from the soil where the fungus grows. Not everyone who gets valley fever experiences symptoms and recover within a couple weeks, but some people can experience severe illness and symptoms much like COVID-19 or the flu, such as cough, headache, fever, night sweats, joint pain, rash. Symptoms of valley fever can last for a few weeks to a few months in severe cases and can spread to other parts of the body. Now, our epidemiologist Jessie is going to share some recent trends on valley fever.
Valley fever is a disease within San Luis Obispo County that is endemic, meaning that we know it's here. We have cases every year, so it's a bit more predictable. Our 10-year average is about 200 cases a year of valley fever. And while we've had a decline in cases since 2017, both the California Department of Public Health and researchers are expecting to have a rise. And this is due to the period of drought that we just had, followed by a really wet winter. During the COVID-19 pandemic, a lot of people didn't get medical care, and that could impact their ability to get tested for valley fever. And the symptoms of valley fever, like cough, fatigue, headache, they all align with COVID-19, influenza. So if you're having those symptoms, go to your doctor, talk to your healthcare provider, and ask to get tested. While the test for valley fever is different than COVID-19, it's a blood test. It's really important to get done so that way your health status is known. For most cases, about 6 out of 10, medical intervention is not needed, meaning that you'll naturally get over the disease by yourself. It's just important to know how you're doing, to get tested if you're feeling unwell, and of course be mindful of your own symptoms.
Thanks, Jessie. Now, how do we avoid getting valley fever? Well, especially on dusty or windy days, close windows of your home. When driving, close your windows, turn your fan to recirculate. If you're working or digging, for example, in undisturbed soil, maybe wet the soil beforehand to prevent dust. Know that valley fever isn't contagious and doesn't spread from person to person. The only way to contract it is by breathing in the dust. And remember the signs of valley fever: cough, fever, exhaustion. And if they last more than a couple weeks, go to your healthcare provider and ask to be tested for valley fever. Take care, SLO County. See you next time.